Welcome to Falling Through the Cracks. Feel alive and thrive with Dr. Rebecca Risk. Do you ever feel that even though nothing seems seriously wrong and you pass all the medical tests, that you still feel that your health, pain, and fatigue are completely out of control? It doesn't have to be that way. Listen to the tips and suggestions given on our program today and take back control of your health. Now, here is Dr. Rebecca Risk.
Hi everybody, welcome back. Today we're joined by Linda Elsegood. She is the founder of the LDN Research Trust and author of the book, The LDN Book, How a Little-Known Generic Drug, Low Dose Naltrexone, Could Revolutionize Treatment for Autoimmune Diseases, Cancer, Autism, Depression, and more. Linda, welcome to the show.
Thank you very much for having me, Rebecca.
So what has passioned you into the direction of low-dose naltrexone?
Okay, I have multiple sclerosis, and back in October 2003, my quality of life was maybe 1 out of 10, and I was told that there was nothing more that could be done for me, and I was secondary progressive MS, and the neurologist showed me out. So I was looking for an alternative, something that, there was no plan B. It was just, and I said to my husband in the car, it just felt as though he'd said to me, go home and die quietly, don't make a fuss, you're an embarrassment. That is how I felt. There was no hope at all. So I was able to sit for 10 minutes at a time, that was all. And I was trying to find, and of course the internet back in 2003 isn't or wasn't as it is today. So I was looking to find other people who had MS and to try and find out what they were taking. I knew I wasn't unique and that there were other people probably with a similar situation as myself. And then I found LDN, and I was told by everybody that if it wasn't going to do me any good, it wasn't going to do me any harm. I gathered all the information together. I found a doctor in Wales who was prescribing LDN. I think in the UK at that time there's about 400 people taking LDN. He got me to take everything to my own GP to ask if she would prescribe it for me. She asked the partners in the practice and they said no. And she said, but if it was her, she would try it. And if I wanted to get a prescription, she would be happy to monitor me. So that's what I did. And believe it or not, living my life at that time was like being in a television set that wasn't tuned in, couldn't see properly, hear properly, couldn't think. I was like somebody who'd had a stroke. And suddenly, after 3 weeks, wow, it was like somebody had started to tune this television set in. It was amazing. I actually began to feel like me again. So that was the beginning of the next chapter of my life.
Well, this is amazing, and the fact that you're still doing well 15 years later is a testament to the LDN, because we know if you have secondary progressive MS, 15 years is not really in your life plan. So I think that that's really, really amazing that it's done this for you. And I know my listeners are probably wondering why we're talking about a drug, because I do focus more on, natural alternatives for situations. But LDN is something that I recommend my patients ask for, because I deal with chronic Lyme. So that means, a lot of people do have MS and other things. And I find the LDN very helpful in their treatment. But, like what you experienced, your doctor said no, she wouldn't prescribe it. Can you just tell us why LDN isn't as well known and a lot of doctors are saying no, even though it has the effect that it does?
Well, first of all, drugs are usually drug company driven. Now, naltrexone is out of patent, and that means that anybody can make a generic version of it. And normally when drugs come onto the market, they've been through lots of clinical trials and studies. And once it's been approved, it's in the doctor's little book, and it would say how to prescribe it. And it's all mainstream. Because LDN is out of patent, over here you do it slightly differently, but we call it being prescribed off-label on a named patient-only basis, which means the prescriber has to take the responsibility of prescribing it. Now, I have found, we know thousands of doctors now that are prescribing it around the world. If the doctors have some experience of LDN, or if they've worked in an emergency room where they've dealt with anesthetic or heroin addicts or alcoholics in the past, so that if they've had some experience of naltrexone and they can see that LDN, which stands for low dose naltrexone, it's usually the highest dose is 4.5 milligrams, and in the past it has been used in doses of 50 milligrams 3 times a day, so that's 150. And when that was trialled back in the 1970s, it was only found to be harmful to the liver in doses of 300 milligrams a day. So at the full strength, it was only half of what was found to be harmful. But if you just think going from 150 milligrams down to 4.5, it's minuscule.
So you mentioned addictions, which in your book you explain the history of naltrexone. Can you just tell us a little bit about that?
Okay, so as I said, back in the 1970s, naltrexone was trialled. It was trialled for heroin addicts, drug addicts. What it did was blocked the receptors so that the user didn't get the effect of the heroin or the alcohol. It just kept they didn't get the highs from it. So with the and I've spoken to some people actually who have used the 50 milligrams 3 times a day, and because it blocks your endorphins, they said they had never felt so terrible in all their life, because your endorphins are your own body's natural feel-good factor and painkiller. So when you've got no endorphins, you just feel completely flat. Your mood is terrible. But working in low dose, and these days, I don't know what you start your patients on, but normally now it's 0.5 milligrams, maybe, for certain conditions, Lyme disease, fibromyalgia, chronic fatigue syndrome, those kinds of conditions where the patient is very ultra-sensitive to drugs, any drugs. And LDN is still a drug, even though it's in a very low dose. And then people titrate it up, and sometimes 2 milligrams is what that patient needs, sometimes 3, 4.5. There are a few doctors that will take their patients higher, maybe up to 12 in certain circumstances, but normally it's usually in between like 3 and 4.5.
So what is the difference between the low dose naltrexone and those higher doses that are used for addictions?
In the low dose, they found Dr. Ian Zagon did lots of studies, and he found that by using a low dose, that you could regulate a dysfunctional immune system. I'm putting myself off now. So, for example, with MS, your body is attacking itself. It's removing the myelin, which is the sheath that covers your nerves. And not only MS, but autoimmune diseases in general causes the body to have a lot of inflammation. And LDN also blocks your opioid receptors, which means your body produces more endorphins. And as I said before, that's your body's natural painkiller and feel-good factor. So that makes you feel good. So that works on one side. The other side of the LDN is that it helps with your toll-like receptors. And once you activate those toll-like receptors, it actually reduces the inflammation in your body. So it has a dual mechanism.
So now one thing that people often worry about with medications is side effects, especially like if you're dealing with MS, you've got medication with high side effects. What happens with the LDN?
Well, we did a survey and we found that only 5% of people had side effects, but that was before starting very low and increasing very slow. Back in the day when I started, everybody took 3 milligrams for a month and then went up to 4.5. And that is why people were noticing the side effects, because for some people, 3 milligrams was far too high to start on, and 3 milligrams was always going to be too high. So now, by doing it slowly, people don't normally notice side effects, but some people still do. You could have headaches, stomach upset, vivid dreams, sleep disturbance, or worsening of pre-existing symptoms. Now, normally the side effects only last for 2 or 3 weeks and then they're gone. So it's not a toxic drug like some of the interferon drugs that you can have for MS. It's the opposite of an opioid. So it's not addictive. It doesn't build up in your system. It only stays in your system for 4 hours and then it's gone. It's done its work and it's producing all these endorphins. And it's the effect of the LDN that is working along in the background, and you only need to take it once a day. So if it stays in your body for only 4 hours, is that endorphin effect lasting longer than that after it's done some stimulation? Yes. It is thought that it carries on working with those endorphins for around 6 hours. Okay, so it reduces inflammation and I would guess make you feel happier in that process. That's right, yes. Okay, so one thing I know you talk about in your book, because it's used for addictions, it will also interfere with some painkillers like the opioids. Can you just talk about that a little bit? You can't have an opioid and LDN in your system at the same time. Now, years ago, it was said that if you wanted to take LDN, you couldn't take any opioids whatsoever. You had to, come off the opioids to go on the LDN. But things have changed now, and it's a case of you can take an opioid, but you can't have it in your system at the same time. So if you took an opioid painkiller, let's say at night to get off to sleep, then take your LDN in the morning. But interestingly, even though low dose naltrexone is a very low dose, there are doctors that are prescribing ultra low dose naltrexone, which starts at even 0.001, which is less than like a grain of sugar. It's very, very, very minute. But they're used because of the opioid epidemic, and we have worldwide people that are addicted to prescription medications who the world is trying to get doctors to stop prescribing and get the patients off these opioids, and these people are suffering with withdrawal symptoms. It's absolutely awful. But there are so many doctors that are using, alongside of the ultra-low dose naltrexone, still using the ultra-low dose with an opioid which makes the opioid far more effective. They are then able to reduce the dose of the opioid and slowly increase the amount of the LDN, and they are managing to get the patient off the opioids altogether where they've not suffered any side effects or withdrawals. Absolutely amazing. So I'm getting these doctors to do some case studies for us so we can actually show that in a professional way. But I think that is a really big deal, as I say, with this opioid epidemic, to actually get people off without them having to suffer the awful withdrawal symptoms.
You know, I definitely agree, because not only is the withdrawal a challenge, but also the pain that's going to still be there. That's why they're on the medication in the first place. And, you know, it's really difficult. And I know this has happened, to just tell patients you're not going to prescribe anymore when they have pain and they are addicted, because that's just what happens with the medication. And it's nice that there is an option to help them with both of those situations so that we can find a better alternative.
Definitely. Absolutely.
We're going to take a quick break. We're talking today with Linda Elsegood, and we're discussing her book, The LDN Book. We'll be back shortly.
The future of online TV is here. View exclusive content from your favorite talk radio hosts and new programs that you can't see anywhere else. Visit voiceamerica.tv today.
Have you stopped to think seriously about hypnosis? Hypnosis can set you on your way to better health, can free you from anxiety, phobias, and so much more. Join host Inez Simpson for Hypnosis Everywhere, Inez Simpson and the Simpson Protocol. This show is for anyone from the experienced hypnotist practitioner to the merely curious. Inez Simpson offers tools and insights from the whole world of hypnosis, with guests and open discussions. Hypnosis Everywhere, the Simpson Protocol, airs live every Wednesday at 11 a.m. Pacific Time, 2 p.m. Eastern Time on Voice America Health and Wellness.
The Voice America Live Events channel is here now to showcase your corporate, individual, or organization's live event. Visit voiceamerica.com/live events to see all of our past live events and find out more. Whether it's a multi-day conference, special speaker, or single-day event, we've got everything to make your event a success. We can do a few hours or a few days. For more information about taking your event to the next level, call Jeff Spinard at 480-294-6417 or email info@voiceamerica.com. Again, that's Jeff Spinard at 480-294-6417 or send us an email to info@voiceamerica.com. Voice America is where you are and where you want to be. Join us around the globe as we broadcast live from some of the most interesting events available. Don't forget to view all our live events, including on-demand access to past events that you may have missed by visiting voiceamerica.com/live events.
Healthcare has been a major part of news stories today, with one thing that has been consistent: inconsistency. Both healthcare providers and patients have to work around and get used to a constantly changing set of rules and issues. Nurses have historically been left out of this decision-making. Listen to Once a Nurse, Always a Nurse, Exploring the World of Nursing with host Leanne Meyer. Health professionals, we invite you to share your ideas and experiences while listening to experts in various areas of nursing. Listen Mondays at 1 p.m. Eastern, 10 a.m. Pacific on Voice America Health and Wellness.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Linda Elsegood. She's joining us from the UK, and we're discussing her book, The LDN Book. So, Linda, we talked about the LDN with opioids, and one thing I want to talk about is CBD oil. You don't mention that in your book, but in Canada last week it was made legal, so people have more options, which I think is great. Now, do those two work really well together, or does the LDN interfere with it?
No, they work synergistically together and work really well. Dr. Wei Lu, who helped Professor Angus Dalgleish write a chapter on cancer in the book. Now, they use CBD oil with LDN for cancer patients, and they're finding it works remarkably well. And we found out about that probably a couple of years ago, but there are many doctors around the world who are using LDN with the CBD oil. But as you say, in some places it's now legal, in other places it's difficult. But for those doctors that can prescribe both are prescribing both, and it works really well.
Well, that's really encouraging. I mean, CBD oil is now easier to get a hold of than LDN in Canada anyway. I know from, I'll just share some personal experience. I take LDN after an accident I had this year. And my doctor, although wanted to help, had never used it. So she called a helpline and they told her not to prescribe it for pain. And I think that, that is one of the things that's getting in the way of this being used more. And so I'm so thankful that, you're bringing this awareness to it, because, then we can get people have more options. I mean, I definitely wouldn't want to take morphine or other medications, which actually don't work for me anyway. And I wish that it was a little bit different. It just seems silly to me that we're asking for medication, not even CBD oil, that is still a little bit out there for some of them, even though it's legal. And we're hitting those barriers still.
Mm-hmm. Well, we also have a radio show, and I've interviewed many pain specialists who are using LDN and several hundred of prescribers. So, if anybody would like to listen to those and hear the experts themselves that are using LDN, and most of these doctors who I have interviewed are quite happy. If you have a doctor who says, I'd need to know more, I can actually put them in touch with a doctor who would be willing to give them the information and share their experience with them.
What's the link for that?
Okay, if you go to our website, our main website, www.ldnresearchtrust.org. Along the top there's a tab, and you can see all the links. And that one is under media, the LDN radio station at the bottom there. And I think there's a link, that direct link is ldnradio.org.
Oh, that's perfect. I think that'd be helpful for people when we're hitting those walls. Now, I want to talk more about what LDN does. I really enjoyed that you did talk about Lyme and other infections. So what does LDN do in that realm?
Okay, well, we have also produced an LDN and Lyme documentary, which is, the link is also on the homepage of our website there. With Lyme disease, it's a very complicated condition, as you must be aware, with all the co-infections. And first of all, it's hard to get a diagnosis. Once you have a diagnosis, it seems to be difficult to find a Lyme literate doctor. And then you have to find the right protocol for you with whichever co-infections you may have. Now, LDN isn't the magic bullet that is going to fix you if you have Lyme disease and you've had it for a long time, but it certainly helps as part of that protocol. It's not a standalone. You do need other treatments to use alongside LDN, but the number of doctors, pharmacists, researchers that I have spoken to who are using LDN in that protocol find that it's really beneficial, that it really helps the patients.
Just to be clear, I don't prescribe LDN. It's not in my scope of practice. But when I'm dealing with complicated things like Lyme or MS, I refer them to a doctor that will prescribe it. And from my observation, I find that they have less pain and a little bit more energy depending on where they are in their treatment. And just, especially the pain, it's very, very helpful for them to then continue to go through treatment and not need, of course, a bunch of medication, or at least less in that process, which is very helpful because Lyme is painful and fatiguing and overwhelming. So to have something that's so simple, and then, of course, they usually get all the side effects, which makes it more complicated. And it's nice that LDN has very little side effects.
And of course, people with Lyme disease, similar to people with fibromyalgia, have brain fog, which LDN really does help with that as well. And sleeping. So many people with Lyme disease don't sleep very well, and they find that once they start taking LDN, that they sleep a lot better, than they feel more rested when they wake up in the morning. Because if you feel exhausted and before the day starts, it's not a very good start to the day, is it? So by getting a good night's sleep is certainly of benefit.
Well, and of course, you can't heal if you don't sleep. So that's one of the hardest things to overcome often, and makes it more difficult to heal, because if you don't sleep, you don't heal overnight, and then you're tired the next day, and then you don't sleep again, and you start this vicious cycle. So having something that helps with sleep, that of course LDN isn't overwhelming in the morning like a lot of sleep medications, which is also helpful. So then the fatigue they experience in the morning is just what their body is experiencing from being sick, not an added medication reaction. Yeah. So you also talk about thyroid disorders in your book. Can you tell us how LDN helps with that?
Again, it's similar to the MS, but your body is attacking your own thyroid, which, LDN helps with so many different thyroid conditions: Graves' disease, Hashimoto's, hyperthyroidism, hyperthyroidism. Again, it helps regulate this dysfunctional immune system, helps to put you back on an even keel, and the toll-like receptors are helping to get rid of all that inflammation and hopefully stopping your body from attacking itself. But we have found that people that already take thyroid medications have to be very careful when they take LDN, because it regulates it quite quickly in thyroid conditions, and you could find that thyroid medication you're taking is too high. So many people have to reduce their thyroid medications, or in fact stop altogether, which is amazing when people have been on these thyroid medications for many years. So it's really important to work with your own doctor, get those thyroid levels checked, so you don't, get into trouble.
Well, some people don't tolerate thyroid medications as well. So it's especially if it's autoimmune thyroid, it can be complicated for them to get that regulated. So it's nice to have another option to help with that. So when you say that it helps quite quickly, is that within a week or within a month?
Within about a month, around that period of time. But as I say, the doctors who are used to using LDN do monitor their patients carefully who are on thyroid medications. But the good thing is people that are on a cocktail of medications, who maybe find that they're taking, in between 14 to 20 a day for pain and whatever other conditions they're taking these medications for, and then you have possible side effects from all these medications. then you get a side effect and you're told, that's okay, we'll give you another medication to combat the side effects from taking all this cocktail of medications. But on LDN, people can start off on, say, 14, 20 medications and get down to only taking maybe 2 or 3 alongside of the LDN. And in some cases, they just go straight down to just needing the LDN and nothing else.
Wow, that's really amazing. I mean, it is a problem when you're taking that many medications because nobody knows what that does in your body. 14 medications haven't been studied together, so it's more of a trial and error of like, how does this work for you? And I would rather have 1 than 14.
Exactly. Yeah.
What does LDN do for irritable bowel disease or inflammatory bowel disease? Sorry.
Yeah, there have been 2 studies by Dr. Jill Smith. She has done amazing work. She did one with her Crohn's patients, and then she did one with pediatric Crohn's. And there are many children that are using LDN. Now, it's quite interesting. You can actually find her information. We list all the clinical trials on our website. But she used a scope, and she showed the bowel where it had the Crohn's, and it was angry and blistered. I mean, it looked absolutely awful. And just, I can't remember how many weeks, probably a couple of months, I think, they were on the LDN. Don't quote me on that because you'd have to look it up. I can't remember how long. But the next time the scope went and investigated, it just looked like the back of your throat. It was clear. All the Crohn's had gone. And I've interviewed people with Crohn's disease, and I had this lovely lady. She was in her 30s. She had 2 children, and she was bleeding. She wasn't able to look after her children. She could just manage to crawl out of bed. She couldn't even walk to get to the toilet, and her bowels were just bleeding the whole time. And she said she felt the complete failure. She wasn't a wife. She wasn't a mother. She couldn't care for her children. She couldn't look after herself. And they took her into hospital and said that she needed to have her bowel removed and have a colostomy bag. She was absolutely horrified, but they said if she didn't have it done, she was going to die. She'd lost a lot of weight, and they gave her the pre-med. They were ready to operate. She'd spoken to the anaesthetist. They were about to take her down to surgery, and she had a panic attack, and she said, no, I can't do it. I can't do it. I've changed my mind. I want to go home. They said, if we let you go home, you're going to die. And she said, I've just got to go home. Just let me go home and I will come back. But today I have to go home. So they reluctantly let her go home because you can't take people prisoner. You can't make them do something. So she went home and she thought, that there must be something. So she wanted to find out what she could do to not to be operated on, basically. And she found LDN, and she persuaded her doctor to prescribe it for her. And her doctor said, you haven't got a lot of time. You're bleeding so heavily. You're going to have to go back to hospital. So she said, okay, I want to try it for 2 weeks, just 2 weeks. And in that 2 weeks, she'd stopped bleeding. She started to feel a lot better. She started to gain weight, and she went back to the hospital, and they put the endoscope into her bowel, and there was no sign of Crohn's at all. It had gone completely. And not only that, she was able to be a wife and a mother and looked after her children, but she was pregnant with her third child, which was something she wouldn't have even been able to have contemplated doing or even having another child. So she was absolutely amazed. But the stories I've heard, you hear one story and you think, okay, how factual is that? But when you hear so many stories that have such amazing results, even if you discounted some of them, the evidence is there. But what we really need is further clinical trials for hundreds of patients over many years, which would cost multi-millions. But that is really what would need doing to convince the medical professionals that, LDN does do what we've seen it can do.
I definitely think that's necessary. We're going to take a quick break. We're talking today with Linda Elsegood. She is the founder of the LDN Research Trust and the author of the book, The LDN Book. We'll be back shortly.
The future of online TV is here. View exclusive content from your favorite talk radio hosts and new programs that you can't see anywhere else. Visit voiceamerica.tv today.
Can grief be good for you? Absolutely. It gets your attention, helping you evaluate your choices and relationships. Your losses define who you are. Tune in each week for Good Grief with host Cheryl Jones. Our show features those who have made incredible transformations by grieving their losses. You'll learn how to find your courage and strength. You'll discover the important things in your life and how to let go of things that are less important. Good Grief airs live Wednesdays at 2 p.m. Pacific Time, 5 p.m. Eastern on Voice America Health and Wellness.
The Voice America Live Events channel is here now to showcase your corporate, individual, or organization's live event. Visit voiceamerica.com/live events to see all of our past live events and find out more. Whether it's a multi-day conference, special speaker, or single-day event, we've got everything to make your event a success. We can do a few hours or a few days. For more information about taking your event to the next level, call Jeff Spinard at 480-294-6417 or email info@voiceamerica.com. Again, that's Jeff Spinard at 480-294-6417 or send us an email to info@voiceamerica.com. Voice America is where you are and where you want to be. Join us around the globe as we broadcast live from some of the most interesting events available. Don't forget to view all our live events, including on-demand access to past events that you may have missed by visiting voiceamerica.com/live events.
Step by step, you made it through the journey of pregnancy. Now your baby is in your arms, and you're on the cusp of a new journey, breastfeeding. As a new parent, you receive a lot of advice, much of it conflicting, some of it outdated. Tune into Born to be Breastfed with host Marie Biancuso to bust through the myths about feeding your baby. Marie and her guests will help you figure out what you can expect and put you on the best and surest path on your breastfeeding journey. Listen every Monday at 6 p.m. Eastern Time, 3 p.m. Pacific Time on the Voice America Health and Wellness Channel.
You are listening to Falling Through the Cracks with your host, Dr. Rebecca Risk. To reach the program today, please call in to 1-866-472-5792. Again, that's 1-866-472-5792. You may also send an email directly to Dr. Risk. The email address is anantacalgary@gmail.com. Now, back to Falling Through the Cracks. Feel alive and thrive.
Hi, everybody. Welcome back. Today we're talking with Linda Elsegood, and she is the author of the LDN Book. She's joining us from the UK today. So, Linda, one thing I think is important for us to talk about is how LDN helps depression, because we talked about immunity and pain, but I think that's really important as well.
Absolutely. not only could you be suffering with depression, and you might have been suffering for many years, but if you have an autoimmune disease and you're coping with many symptoms that are quite debilitating, and every day is a struggle to think, a struggle to move, a struggle to hold something, depending on what your autoimmune disease is, that in itself can be very depressing. So to actually have LDN, which boosts those endorphins, makes you feel so much better anyway, and to reduce the inflammation, as we've talked about before, is amazing. And there are so many psychiatrists and psychologists that are using LDN in their practices, but not only for depression, but also post-traumatic stress, which has been used for war veterans, but not only that, for rape victims. I mean, there are children that are suffering with post-traumatic stress. LDN works really well in the mental health field, which is quite a big thing over here in England at the moment, and I'm sure it must be in Canada too. So not only depression, but helping with mental health issues across the board, really.
Well, that's really amazing. I mean, especially if you're talking about children, if they've experienced a trauma or whatever is going on, to put them on medications that are addictive is really hard to do to a child, which all antidepressants are. But, also the thing with LDN is that, it's not going to change who they are, which a lot of antidepressants can do. I mean, a lot of people report feeling flat. They're not depressed, but they don't get super excited. And LDN doesn't do that from what I've observed. So then, you can help someone, especially a child or anybody, and just make them feel better, which I think is a better option.
And also, it's used for fertility as well. And we know that mothers take it to become pregnant. They take it during pregnancy, after pregnancy while they're breastfeeding, and the babies do really, really well. Dr. Phil Boyle is going to write a paper when he has time to collate all the information he's had from all these patients. And we know that children are using it not only for, autism, pediatric Crohn's, pediatric arthritis, allergies, eczema. It's, really a drug that can help children make their life a lot easier when they're younger. I mean, like we were saying about the Crohn's, when you've got pediatric Crohn's, that child cannot function and join in sports and games like the other children. But to have LDN to help, has to be a good thing. And with children with autism, I've interviewed quite a few parents. The one little boy came to the conference, one of Dr. Brian Udell's patients, and this little boy, even when he was very young, wouldn't be cuddled or held, and he used to slap his mother, and I think he was about 3 or 4, and she used to say to him every day, "I love you, Jacob," and he used to kick her, slap her, never let her cuddle him or anything. And he started on LDN, and it was like 3 weeks later, and she was saying, "I love you, Jacob." And he turned around and put his arms around her, which was, absolutely amazing. And he kissed her and said, "I love you, Mummy." Aww. So she called her husband and she said, "Quick, fetch the video camera. Fetch the video camera. I want to say it again. I want you to video it because he may never, ever say it again." That's how she really believed at that time. And he's gone on, and he is an amazing young man. He's a piano protege as well. He's very intelligent. He can play Bach, Beethoven, whoever, without any music. He's just really a talented little boy, and he can function, I hate to say normally, but he can lead a normal life, which is absolutely amazing, and his parents are totally blown away by it.
Well, you know what, I'm blown away as well, because that's something that's it's difficult to help a child with, and here, you know, this simple generic medication that's not very expensive in the scheme of medications has turned his life around, which is amazing.
Yes.
Yeah. So, you mentioned cancer earlier, and I know you talk about it in your book. Obviously, LDN isn't. Well, what does LDN do for cancer? I guess I'll let you tell us.
Okay, well, very excitingly, just after the book was published, we were hoping to be able to include it. Professor Angus Dalgleish and Dr. Wei Liu had written a paper. To say it was super exciting is an understatement. I actually went to a meeting, and I'm not medical, and I was there with researchers and oncologists and pharmacists, medical people who knew what he was talking about with this presentation. And Dr. Wei Liu was very excited, and his arms, you know, and he was smiling, and everybody was jumping up and down, and I must admit, sort of 60% of it went over my head, didn't understand it at all. But what he was saying and what he had discovered in the laboratory was that he could actually treat LDN on the cancer cells and get the cells to stop multiplying, because a cancerous cell is a cell that just keeps on multiplying and getting bigger. But he was actually able to put the cell into remission so it didn't grow. And then by using pulse dosing of LDN, it was causing cell death, and the cancer died. And it was like, wow, this is truly amazing. So he was going to have his paper published. It was all hush-hush and top secret, but the results were so astounding that even though peer-reviewed and everything to get it published, the results were too good. He was going to have to do it again. So this was like, oh no, it's not going to get in the book. How long is it going to take to do it again? So he replicated it, but the results were a mirror image of each other. They were exactly the same. So nobody believed that he'd actually done them twice and got the same results. He had to do the tests a third time. But the paper is now published, and there is a link to that. We have 3 documentaries. We have one called The LDN Story. We have one called The Game Changer, which is the LDN and cancer, and we have the Bullseye, which is the Lyme disease documentary. And all 3 of those are on our website, and they're on Vimeo. And underneath on the cancer one is the link to the paper. So if anybody would like to read that paper, it's all there. You can see it, but it is absolutely amazing. And of course, a cancer cell is a cancer cell, whether it's in your liver or your lungs. But there are many people that have tried radiotherapy, chemotherapy before having tried LDN, and they're stage 4, and they are in palliative care. Now, if you have enough time to use LDN, it can really help. But if you've left it too late, it doesn't always, which is really sad. And I can speak for myself because my mother, unfortunately, was diagnosed with cancer. And I help all these people with cancer, and they do really well. But by the time we knew my mother had cancer, it was too late, which was very unfortunate.
Yeah, I'm sorry to hear that.
Yeah. If you can start it as soon as you know, it's amazing. But it does help with some people as well further down the line. But it depends where it is, how bad it is, etc., etc. And it's the same with cancer, autoimmune diseases. it's personal to that person. You can't really pigeonhole people, can you? Because everybody's illness is slightly different from, like if you put 100 people with MS, there'll be lots of things in common, but everybody's is unique to them.
Mm-hmm. So I've really enjoyed talking about this. I hope that the information for LDN does get out there, and we touched on it a little bit about why these huge studies aren't being done. But I think it's important just to make people aware, because I know in my case, my doctor was told not to prescribe it because there wasn't enough studies, and this is because the patent has run out on the medication. So can you just explain to everybody what that means?
Well, it means that, as I said before, mainly studies and trials are done by drug companies when they first develop a drug. And that means they can charge a really high amount for those drugs for a certain period of time, which allows them to recoup the money that they've spent on all the trials. And after which point it's then the patent runs out, and then that means any manufacturer can reproduce that drug. They've lost the exclusivity of it. So that is what's happened with naltrexone. There isn't a patent on it where somebody can make a huge amount of money from it. Mainly it's a compounded drug, and in tablets, capsules, cream, sublingual. There are actually some pharmacies that do a gummy bear, which I've only heard of once, which was quite interesting. But it's a case of, with LDN, it's not like paracetamol, take 2 full times a day. You have to really find the dose that's right for you. And people will say to me, how will I know that the dose is right for me? Well, if you, say, start on 1.5 and you increase it after a week or two to 2 milligrams, and you feel, oh, this is good, this is really good, and then you go up to 2.5 and you don't feel as good as you did, it's always best then to drop back to that lower dose, stay on it for, say, a month, and then try and increase it again in a fortnight or a month's time and see how you feel. And if you still don't feel as good, well, then that's probably the right dose for you. But you can always leave it a few months and try again and see if a higher dose works for you once your body is used to it. I take 4.5, and I've stayed on 4.5 now for over 14 years. It'll be 15 years in December. The time goes so quickly. And as you were saying, I do very well with my MS, and if I can stay like this, I'll be more than happy. When you have a progressive disease, I mean, some people will say, oh, I've been on LDN for 2 years and I think I'm going to stop taking it. It doesn't do anything for me. It's not ever helped with anything, so why am I taking it? But if you have a progressive disease and the progression has stopped, in my book, that's working really well. If you can actually halt a progressive disease. But then some people stop, and their disease progression starts, and then they'll say, oh, I forgot. I used to have such bad brain fog. I've forgotten that I used to have a lot of pain. You know, it's very easy when you are sick and you're progressing slowly. You notice every single thing you can't do that you could do yesterday. But when things start to improve, it's just the way nature is. You forget. It's not until you stop and then all these things start to come back that you remember how good you felt while you were on it. So it's something that people will say, do I have to take it for life? Well, if you want it to work, yes, you do. But it doesn't build up in your system. It's not harmful. There haven't been studies and trials on that over a long period of time. but I do know some people that have been taking it since 1985, and they're still doing really well. They're still not having any side effects. But if anybody has a doctor or a pharmacist who is interested in LDN, we have past conferences that are available online. We also are having the next LDN conference in 2019 in June in Portland, in Oregon, and we live stream them. So any doctor in Canada or Australia, New Zealand, Europe, anywhere, they can either come in person, which would be great, or watch the live stream, or the live stream recordings at a time that actually suits you. So we are really trying hard to educate the medical professionals, and we're doing all we can to get it out there.
Thank you so much for bringing the education out to everybody. If people want more information, how can they get a hold of you or your book?
Okay, if they want to go and have a look at the website for all the things that I've mentioned, it's ldnresearchtrust.org. And if they would like to send me an email, I'm always more than happy to answer questions. If they send it to contact@ldnresearchtrust.org, and I'll get back to them.
Well, that's perfect. Thank you so much for joining me today.
Thank you very much for having me as your guest.
And I want to thank everybody that's listening. If you want more information on my story and what I went through with chronic Lyme, it's on my blog site for this radio show at dr-risk.com. And don't forget to follow me on Facebook, Twitter, Instagram, and all those fun social media websites. And thank you so much for listening. Just be sure to make today a great day.
Thank you for tuning in to this week's edition of Falling Through the Cracks. Feel alive and thrive. Please join Dr. Rebecca Risk again next Monday at noon Eastern Time and 9 a.m. Pacific Time on the Voice America Health and Wellness Channel. We'll talk more next week.